All right.
Hello, everybody. Thank you so much for coming and for joining us on our live presentation today. I am most grateful. And again, forgive me. I'm like 5 minutes past the time I said I was going to. But, of course, Carlos has it all together. His mother does not. So that's how that goes. But I'd like you all to know that Carlos Harlow is here and he's going to be navigating and helping me out. And this is my son. Of
Hello, everyone.
Yes. He is a digital marketing professional and he has a master's degree in EMAC, which is emerging media and communications. He also has a Bachelor of Science degree in business administration. Carlos is a publisher, he's an author, he's a poet, and he's a podcaster. Carlos has written and published approximately 16 books, one of which was my first published book entitled Seven Imperial Gemstones of Life.
Yes.
Um, and thank you for helping me, Carlos, and doing my presentation and promotion of my classes in medical coding and billing.
Oh, of course. You're welcome.
Carlos, you can tell us whatever you want to tell us and get us started and get us going. And we
Okay.
will be glad to. I want you all that are on and to hear and participate and be a part of the presentation. And any questions that you have, any concerns, any thoughts, comments, feel free to express them and we will get to them just as soon as we can. And we will do that. Okay.
Okay.
I also, while I was preparing to get the slides ready for me, I want to give a shout out to Thressa Sweat for her years of promotion and her publications and things that she's done for me down through the years. And I want to say thank you so much, Thressa. But big love to you. And
Yes.
now we'll start with our initial screen and we'll go from there and I will talk to you and you can tell me what you'd like to
Go back.
yeah, that's okay. We'll go back. We're going to go back and we're going to go back into the first screen and we'll talk about that. And we will go from there and give you the information that we can on medical coding and billing and how helpful the career is and what it does for people now and what people are doing now and how we need much more of it. I want you to know again that I'm Deborah Harlow Swisher. I'm a certified professional coder. I was the 2023 educational officer for the Houston chapter of AAPC, which is the American Academy of Professional Coders. I have 40 years of experience in coding, all fields of medicine, physical anesthesia, psychiatry, home health, and all sorts of things. Any subject that you can bring up or name, I have experience in coding that particular subject. I have 37 years of instruction that include teaching physicians, nurses, allied healthcare workers, and lay individuals in the art of medical coding and billing. This particular presentation is going to tell you about the upcoming course. That's the one that's going to start during the week of July the 7th. And that will be for July 7th. I try not to ever go into holidays, so it will end the week before Thanksgiving. You will have completed it and you will have all the information at that time you will need in order to become a certified professional coder. This is a unique class and that it's comprehensive. You have 5 months, and we teach in that 5 months. You will learn medical terminology, you will learn anatomy and physiology. For many people, they already have that. You just need to brush up on it, and we'll have that. You will learn how to do diagnostic coding, and that's known as ICD 10 diagnostic coding. We'll talk about that further as we go on. CPT coding. Hello, Loretta. CPT coding. We'll talk about CPT coding as well. And we'll talk about Hicks Picks supplies, materials, injections, etc. Talk about coding compliance. I hear some noise in the background from somewhere, huh, Carlos?
Oh, yes.
Yes, okay. I didn't know if you were hearing it too. So we're going to cover those kinds of things and we're going to talk about those and let you know whatever it is that you'd like to know about the subject matter. And so we'll go on and we'll look at the next slide and I'll continue to tell you more about it. Hicks Pick surgery supplies and injections and things like that. I have been honored on a national, state, and a local level for outstanding instruction in medical billing and coding. In the city of Houston, the honor was given as a proclamation from the late Sylvester Turner, who was the mayor at that time. On a national level, it was an honor for the occasion of teacher appreciation was presented to me by the late Sheila Jackson Lee. And on a state level, it was presented as a flag and a recognition for by the Senate of the state of Texas, which was Paul Betancourt. So I'm grateful for those things. I'm honored and I'm humble. And I wanted to say thank you. And I want you to know that I have been teaching for a long, long time. And I enjoy it. I enjoy the people. I enjoy what I do. And I enjoy the idea of being able to help someone to change their lives for the better in their careers and in their financial situations. And whatever we have. All right. I'll tell you again, I'm honored to have the privilege of instructing people on the recognition of medical terms, how to use them effectively, how to apply them to everyday medical problems and solutions so that you can achieve your optimal amount of reimbursement. And the key word here is legally. There are many, many people that get paid for reimbursement. They don't get paid legally. So we do not want that to be the case, because even though the wheels of justice may turn slowly, I want you to know that they do forever turn. And people do become legally entangled in prosecutorial problems and things of this sort when they do things illegally, wrong, fraudulently, or in an abusive manner. So we make sure that we teach you and things that are going to keep you above board and keep you in a good spot so that you will know and be able to legally navigate this very, very fluid and ever-changing system of medical coding and billing. The first class is going to start on July the 7th, and that will be Mondays and Tuesday evenings. It will go until November 18th, and that would be from 6 to 9 p.m. The next class is going to be Tuesday, Wednesday mornings. That's July the 8th to November the 19th. That class will be in the 10 o'clock in the mornings until 1 p.m. in the afternoon. On July the 9th, we'll have Wednesday and Thursday evening classes. And again, like the Monday, Tuesday, they will be from 6 to 9 p.m. and they will go through November the 20th. These different courses have been arranged so that at any time during the course, you can exchange your scheduled time by extending. You can attend another more convenient class within the same week whenever you have your regularly scheduled time and you can't adhere to that time. And you can do that due to any special circumstance that may crop up. And that way you can attend any of those classes. You can enter exchange or go to any class. If you're scheduled to be Monday, Tuesday, you can come to Wednesday, Thursday, and there's no additional charge for that. You don't have to worry about paying extra money because you're going to a different class. So I want you to know that you can attend any of them or all of them. Once you've become a registered participant, you are open to attend any. You just must register with one of the three courses. You have to choose one of the time frames, and that would be your main course time. But if for some reason, again, you cannot be there for this week's Monday and Tuesday class, then Wednesday and Thursday is open to you. If you can be there on Monday but not Tuesday, then you can choose to come on Monday and then on Thursday evening, or Monday and say Wednesday morning. But it's arranged such that it will accommodate you and allow you to be able to get in and to come in whenever you need to and whenever it's convenient for you. The teaching style is unique. It's unparalleled by any other instructor. It includes a vast knowledge of medical terminology. You will learn a lot of human anatomy and physiology. It will encompass all aspects of human health care. And it has common sense approaches to resolutions in medical coding and billing. In addition, the instruction is filled with real life stories. I give you real life stories and case scenarios, as well as actual personal and professional accounts of coding and billing examples. Altogether, these factors lead to the ultimate goal for each participant. You are going and shooting for excellence in the field of coding and billing. It is not good enough for me for you to be good at it. I want you to be outstanding, above reproach, and exceptional, a cut above the rest. If you come to me with a strong will, I'm here to tell you I will make you a way. For where there is a will, there's definitely a way. You have to have no prior experience in order to participate in this class. You just need to be 17 years of age and older. And again, you don't have it. As a matter of fact, oftentimes people that come with no prior experience do exceptionally well. So I want you to know that that is not a requirement in order for you to join us. All right. With medical terminology, we're going to start first with The Language of Medicine by Chobner. It's the book that you see pictured here, Davy Ellen Chobner, Language of Medicine, and I want you to get the 11th edition. And the reason I've chosen it, I do realize that there is a 13th edition, and maybe even more. It's much more. They have several different editions that you can choose from. But we're choosing an older one simply because it's much cheaper. It doesn't cost you a lot of money. Some students have gotten it as cheap as $10. Others have gotten it, say, as cheap as $40. The new book, the 13th edition, costs $100-something. And the reason we're using the older one is because our main goal is to learn about human anatomy and medical terminology. And of course, human anatomy has not changed. The body is still configured in the same way that it was years ago. And this book will suffice, and it will not cost you a fortune in order to do that. And you won't need this book until 1 month after class has started. We will spend the first 3-4 weeks going over the information that I will provide for you, and you will not need the book. And then once you get into that book, a month later, you'll see that we will have covered 4 chapters of that book without you having it. Again, that is arranged so that you can have a chance to register, get your tuition, your supplies, whatever, and you don't have to get everything at once. You don't have to get it and have it all in one time. What this book will do is it'll give you definitions. It will give you medical abbreviations, which is what I will also give you prior to getting the book, and the word structure so that you can understand how the words are structured and how the function goes with these particular terms. Examples would be like with the musculoskeletal system, you're going to learn about the bones, your joints, and your muscles. Another example is in the behavioral medicine or in the psychiatry section, you learn about mental and psychosocial disorders. The construction of the human body is anatomy. The function of the human body is physiology, how it works. Problems that are associated with it, those would be the diagnostic coding prep problems that we're going to learn and discuss. And the resolutions and the evaluations for those problems, those are things that you will find you will do in the CPT, procedural or providing coding prep. This book is a very good book to keep forever. You never want to get rid of this because it will always be a good reference for you to use and to refer back to. With diagnostic coding, this is the first book that you're going to use when you start to code. I recommend strongly that you get this book from PMIC. That is the book that you see here. It is not one of the cheaper books. It is one of the books that's on the more, it's not the most expensive, but it's on the better end because it's a better book to use. It is more user-friendly. What this book does with ICD-10, CM, and it's for International Classification of Diseases. It's the 10th revision, clinical modification. That's what the acronym represents. This has to be used in all forms of coding when you're seeking reimbursement from a third-party payer. This book answers the question as to why you are seeking medical help. This book tells you that everything that's medically necessary, you have to be able to explain or to demonstrate why you have sought out medical help. This is why ICD-10 or diagnostic coding becomes very, very important. This will also help you to prioritize, and we will help you to optimize your codes so that you can receive optimal reimbursement, again, legally. This book will help you identify problems. You can point out illnesses, accidents, injuries, and it also will indicate prophylactic and preventative services like vaccination type services. and helps you to apply the proper codes for each and also the proper order. For example, many people out here say, well, I can code. This is not difficult. It's not going to be, and it's not difficult, but it requires more knowledge than people think it does. For example, physicians will say stuff like, and they will write diagnoses, and they will just write RSV, or they'll just write SOB, or DUB, or CVA. They're not going to take the time to spell those terms out to you. They're going to write them in medical abbreviations, and it is your job and your demand to be able to recognize these medical abbreviations and apply the proper codes. For example, RSV simply means respiratory syncytial virus. And you need to be able to apply the proper code because all the physician's going to write for you or whoever the provider is. They're going to write diagnosis, RSV. And it's your job to know how to find it, identify it, and code it properly. SOB is for shortness of breath. And you have to be able to recognize that that's what that means. DUB, dysfunctional uterine bleeding. CVA is the term that they will use medically that means a person has had a stroke. It represents cerebrovascular accident, but CVA is the medical terminology for a stroke. CAD is medical terminology for heart disease, when a person has coronary artery disease. When there are accidents and injuries, you want to be able to identify them properly and code them accordingly. Things like fractures and things of that sort. You will get all of that information here. So once we do start using this book is the one that we are going to use for the longest amount of time and do the most in-depthness with, simply because it's the most crucial in any form of coding that you perform. And we'll look at the next one. This one is the book that identifies the solution or whatever they've done. This is called CPT. And this is the book that you will need in order to identify the solution. The last book identified the problem. This is going to identify why something was done. It's going to answer that question as to what was done, and it's going to tell you what they did, and in order to prioritize and optimize your reimbursement again. We're going to identify the services and the procedures or the solutions that was the solution that was rendered in order to get the provider or the physician paid. For year 2025, you have over 1,400 codes that have been updated. That's in several code books. They are new, they are revised, deleted, converted, or collectively all changed. And that's within the collective books of the CPT, the ICD-10, and the CPT and the HCPCS manuals. Examples of CPT service and procedure codes include, but they are not limited to, doctor's office consultations. You learn how to code observation, inpatient, hospital. You'll learn how to code home visits as well as telemedicine visits. Telemedicine now is a big part of medicine, which it was not so many years ago. Hospice and home health care is something now that we're going to have, and we're adding that in so that you can get full information and correct information, because there are lots of legal ramifications and problems associated with miscoding of home health and things of that sort. So you want to get that straight. Emergency medicine, urgent care visits, surgical interventions when people are having surgery. You want to get that in proper order. Any type of prophylactic procedures, vaccinations, and things that they're doing, preventative medicine, preventative care things. When anesthesia is administered, anesthesia is easy to code. You just have to be able to do the math properly. And there's a mathematical situation that you have to be able to do when you're doing base units, time units, plus any other what they call qualifying units. We'll talk about that. Psychotherapy. This is where you probably have the most prosecutorial action of all, because there are many people out there saying that they're administering psychotherapy, and not so much. X-rays, MRIs, CAT scans, anything that you do like that, blood and body fluid examinations, like in the laboratory, pathology things, all sorts of information on reproductive care. These are the solutions to what happens with those different entities and more. And you'll find those in this book. That's the CPT. Again, that's current procedural terminology. Hello, Leslie. Beautiful Leslie. All right, what's our next screen? Okay, with HCPCS, this is the book that you use to code for medical supplies, for materials, for injections, and other services. These procedures that are not reported by CPT. You have medical beds, wheelchairs that you have to be able to charge for, crutches, medication, especially IV intravenous type medication, CPAP equipment, breast pumps, surgical boots, casts, and slings, when people have oxygen tanks or supplies of oxygen, any air, ground, ambulance type things, dental procedures. Any procedures or supplies of things that you will not find in CPT, you will find them in level 2 coding, which is called HCPCS coding. That represents healthcare's procedural coding system. The HCPCS is pronounced HCPCS. Also, rehabilitative services. Hello, Jackie. Oh, and look at the precious people, the little pictures. They're gorgeous. Yeah, so these are all the things that you see in these different books. And this is why this regimen of 3 becomes very important. You have to identify them, identifying the problem. That's the first one. You have to provide the solution. That was the second one. And this one further provides more solutions that you don't find in CPT. Okay, that's what we're doing thus far. Now, here's some examples of when you start to code. Some of those cases that are simple cases, and we'll learn to do those, and we'll move into the hard cases. But again, by the time we're done, you will be able to code anything from the most difficult to the most simple. I want you to be more than well geared for this position. I want you to be excellent again. So, for example, let's say you have a 7-year-old boy that has an inguinal hernia. The diagnosis would come from the ICD-10 book, the first book you saw, and that would come in as something like K40.90. That's for an inguinal hernia. But the procedure code would come from the CPT book, the gold book that you saw, and that code would be 49505, meaning that they went in to repair the inguinal hernia. So the child had a hernia, they repaired it. That would be simple. Then you have another one that would be like, say, John Beatty is a 12-year-old child, and this child has severe throat pain. He is a new patient of Dr. Kyle's. He's in Dr. Kyle's office, and he has spent 50 minutes with John reviewing all of the previous medical records the doctor has. And the doctor does a thorough history and exam, and then the doctor prescribes antibiotics for John. So the diagnosis for him would be an acute tonsillitis, and the code would be the J039.90, which again you'd get from that first book. That's your ICD-10 code. The procedure code, CPT code, would come from the gold book, and that would be 99204. He's seen him for the first time. He's a new patient, and he had to do some thorough exams, so we would go to level 4 and say he would be a new patient that had an office visit. And the HCPCS code would be an additional code we would add to indicate that he did prescribe and administer some penicillin. And the penicillin code would be come in as J0561. So those are examples of some simple cases, but we'll be able to get those as well as many, many others. Now we're going to look at some examples of more complex cases. Hi, Cherie. Beautiful, Cherie. Good to see you, Cherie. Yes. Now we're going to let's look at some, the complicated cases. Let's say Mr. James Peabody, he's involved in an auto pedestrian accident, and he sustained the following injuries. He has a broken thigh bone, which would be a femoral fracture. A broken index finger, we would call it an MCP joint fracture. He has a hemopneumothorax, which means his lung is collapsed. There's free-flowing air or something, maybe blood in his thoracic system. And then he also has a closed head injury. What they would have to do for this person is we would first get all the diagnostic codes listed as you see them here. And then we're going to list everything that they had to fix. They had to go in and do what they call an open reduction internal fixation of the femur because it was broken. They had to do the same thing for the finger. And they had to do a thoracotomy. And that is to go in and cut the chest open. And once they've done that, they've got to find the source of the problem and alleviate the free-flowing blood and air that's running rampant in the chest. And for the closed head injury, they're going to do something called a ventriculocysternostomy. And a ventriculocysternostomy means they're going to put a hole in this person's head, like say you'll see bolts sometimes, or people have screws or bolts or things, and that's to alleviate pressure from that person's brain. So that would be more of a complex. And in real life, you wouldn't see all of this together in actual coding, but for lessons, you're going to get this together so that you will know how to code for the musculoskeletal system. You'll know how to code for hand and wrist. You'll know how to code for the cardiovascular system and for the neurological system. That's why you get these as an example so that you can see how to get in several different phases and cover those phases. Now, look at another example. We have Mrs. Kravitz. She has chest pain, and Mrs. Kravitz has coronary artery disease, and she has hypertension. She needs emergency surgery. So, with her coronary artery disease, you get the code of I-25.11, and then they have to do a graft, which is called a coronary artery bypass graft times 3. That means they're going to take 3 vessels, and they have to repair those 3 vessels. The first code means that 33533, they're going to use an artery to fix an artery. That second code with a little plus sign in front of it, you will learn that that means this is an add-on code. And we're going to do a coronary artery bypass with 2 venous grafts. That would be the code that would have to come after the one with the arterial grafts. And you'll learn as we go why arteries have to be coded first and veins must be second. In addition, the person has hypertension. You do want to mention that, as well as the fact that the person had chest pain. The chest pain was the identifier that let them know that they had coronary artery disease. So those would be more complicated, but we'll be able to cover them, and you will be excellent, not just good, but excellent at getting these jobs performed. All right. Now, I want you to know that the median salary, this is just out of the gate, for somebody that's a certified professional coder in the United States is right at $70,000. Some people make more, some make a little less, but these salary ranges depend a lot on the actual field of medicine, like if it's general or is it family medicine, is it trauma, is it emergency medicine, the regional location, whether you're in a rural area or in an urban area, the medical specialty, be it psychiatry, anesthesia, or whatever, the different states in the United States, like Washington, Texas, California, Florida, Ohio. Some states tend to pay more than other states do. Remote coding jobs are consistently on the rise. They're all over the place. They're throughout the United States and internationally. And since COVID in year 2020, since we had gone through the COVID-19 pandemic, it has been a consistent thing to have more remote coding jobs. They found that it works beneficial in this particular field, so almost all of them are that way. There are some that are still in-house and on-site, but many coding jobs are remote, and you can be in one state coding for someone in another state once you have, gotten the proper hookup in order to do that. So it's a very, very lucrative field. And I want you to know that, and so that you'll know that it's very good, and not many people are able to get it precise and correct as it should be done. And that makes it good for you. All right. We're going to learn about medical insurance and compliance. Coverage terminology. We're going to learn what it means to talk about pre-authorization versus verification versus predetermination versus exclusion policies in your third-party coverages. Types of medical insurance, the different kinds, Advantage Care versus an HMO versus a PPO or an IPA, etc. You have third-party payers like Medicare, Medicaid, Blue Cross Blue Shield, United Healthcare, Cigna, workers' comp, disability coverage, and the list goes on and on and on. You have to know how to do and how to apply each one, and they will kind of guide you. They'll give you, but they're not going to switch out code because their job is to keep from having to pay you. Your job is to make sure that they do just that. So they're definitely not going to teach you, but we're going to teach you. I'll teach you how to code. The rules and regs for submission of the claims, you're going to learn about that. There are some national rules, and there are also local regulatory agencies that have rules. And you need to know when each one is appropriate for what type. And we'll make sure we talk about that. And next thing that we're going to talk about is anesthesia. You will learn how to use base units, time units, and qualifying circumstances so that you'll learn how to code anesthesia. Anesthesia, again, in and of itself, is not difficult to code at all. But anesthesia, when you have to make sure that you get all the math right, add up all the base units, add up all the time units, add up all the qualifying circumstances. And that's what makes it more of a tedious thing to do. But again, it is a wonderful payer. Anesthesia, on an average, people make about $50 an hour. It's a very good field to be in as a coder. All right. And the next thing we're going to look at is I want you to see how psychiatry works. There's a book called a DSM-5. And then there's another DSM-5, which is the text revision book, the TR. In these books have exclusive information on behavioral medicine, psychiatric codes, things of that sort. There are lengthy explanations in these books. They will help the clinicians and the researchers define and clarify mental disorders. They provide standardized criteria. It enhances the accuracy of your diagnoses, and it will inform the treatment decisions, and it supports the scientific investigations. But have no fear. You already have this book that we showed you earlier. You see the ICD-10 CM? That book in chapter 5 includes everything that you will find in DSM-5. It has it all there. Thank you so much, Attorney Swisher, my niece. It's so good to see you. Thank you. Thank you so much for saying that. And I was so honored to have you there. Yes. All right. Now, on the next thing, but I do want you all to know that before we leave this, that even though those things in DSM-5 are very clear and they're very concise and they're very, lengthy in their explanation, all of those things can be found in the ICD-10 book. And you can code from that. You don't have to. And if you work for a psychiatrist or any behavioral medicine entity, they're going to have DSMs at their site. But you're going to actually learn that from the ICD-10. Okay, and so we'll look at the next thing. Home health and hospice. I'm going to add that in. We're going to talk much more about that. And as a matter of fact, let me pause and say to you, we're going to have a home health and hospice class. If someone is interested, that class is going to cost a fraction of the cost that it cost for the class that's already at the phenomenal low for this one. But you're going to have a home health class, and the home health class will probably take about 8 weeks. And then you'll spend 4 hours a week, in the class doing whatever we're going to go over this kind of thing. So you're looking at about 32 hours, more or less, of education in home health and hospice. But you will be well versed in the difference between hospice and home health coding. You will learn the facts that have to be documented so that you can get the optimal reimbursement in each entity. You'll learn how to avoid the red flags of home health coding and billing. We will capture those charges that are frequently unbilled due to lack of billing knowledge, and you will understand the significance and the proper use of revenue codes. Proper utilization of all sources for increased coding accuracy and efficiency. We're going to do all of that so that you can get that and understand that and see how it should be paid, again, properly. HIPAA. Oh, we're going to discuss the HIPAA laws. Almost everybody knows about HIPAA laws in the healthcare field, and we just know that HIPAA laws say that you cannot share my information. You can no longer, I can recall some days way back when, and we just won't talk about it too much now because it now would be considered kind of illegal. But, you would hear about somebody that you knew and that person was ill, or you saw it on the computer in the hospital or whatever, and people would go, oh, well, just let me tell you, did you know that Mrs. Kravitz was here? And Mrs. Kravitz, those kinds of things are not allowed now. You cannot do that. That will get you some big trouble. And usually, immediately, you will lose your job. Immediately, normally, that your job is going to be gone. So you don't want to do that. You really want to. But HIPAA is so much more. You will learn about the HIPAA mega rule. You'll learn about compliance. You will learn about things that are required in order for you to be able to make it and to navigate through life and keep yourselves out of danger zones where you're sharing information, discussing too much information, or things of this sort. You don't want to get into that kind of thing. So you want to have all of the rules, and you will learn how these rules also are more broadened now. The rules do not just include the hospital workers. It includes everybody that comes in contact with them. And so we'll talk about that. You'll learn that, and you'll learn how to use that effectively in your field of coding. All righty. Oh, not a problem, Natasha. At least you're here. All righty. Good, Tosh. Now, we're going to have mock exams, and I'm going to give you mock exams. These exams are optional. They have no bearing on your ability to pass or not pass the course. The exams will have no effect on your final grade in the course. They're only presented so that you can assess yourself, engaging your preparedness to take the national exam, which is a certification exam administered by the American Academy of Professional Coders. And that exam again is a CPC. I took it in 2003, but it's called CPC, Certified Professional Coder. So I want you to know that you can take the mock exam. In my class, in order to pass, you need to just, if you come, and you come most of the time, and you are there, and you're there, and you're listening, and you provide, and you do whatever homework we have, and you turn that in. This is not a pass or fail or give you a grade, and you get a grade, and you can't cut the mustard, so you're failing, or we're beating. I'm not the time and attendance police. I don't beat people up because they were late to class. I don't beat them up because they have to leave early. I just say, become friendly with somebody so that you can get the information you've missed. So I want you to know that it's not like that. We are very easy. It's calm. I want you to relax. I want you to enjoy yourselves. If you're in the evening class and you need to eat your dinner, then by all means, we're on Zoom. Eat your dinner. Just figure out how you can get some of it over to my house, but do what you have to do. Okay, and we're going to look at some more stuff too, and we'll tell you some more. Now, this is the cost of the course. The July through November 2025 course rate for it's only $1,200. It's been that same rate for eons. We've not changed it. For all the former students seeking a refresher, the fee is only half of that. That's $600 of the special tuition rate. And again, I want you to know, if you're a former student, depending on the last time you attended the course, we can adjust the adjustment. Just make sure that you email me or call me or whatever, because we will, do that according to, if you haven't attended within 5 years, then yeah, you're looking at 600. But if it's been sooner than that, or, more recent than that, then we can work on other things. So you don't have to, worry too much about that. And the tuition can be made in one lump sum, or it can be made up to 3 installments. People always ask me, how can you offer a course at this price when you have local, in-classroom, and virtual schools, as well as online other programs? These programs cost as much as $20,000. Are you crazy? I've heard that so much, I cannot tell you how much. But I say to you, as an experienced instructor and a coder with over 37 years of experience, I know what it takes to get you up and running in the career. I don't have to rip you off to do that. With massive student debt and an inability to be properly equipped for your workplace, we don't want to leave you like this. With my unsurpassed record of vast experience and expertise, I can provide you with the specific tools and the knowledge you need for success, while helping you to stay financially solvent during and after this course. So you're not hung out with some major student loan that you can't pay because you don't have a job or something to pay it, or you haven't gotten it yet, and they've gone on and they've gotten them. I don't like that kind of thing. It's not necessary. I'm at a position where I can definitely get money from the federal government, and I can get grants on your behalf. In order to get grants, they demand that we do certain things, and they demand that I take a certain amount of money from you. That I do not like, so I will not do that. This is why I've not done that for years. So I want you to know that 2 or more installment payments will be assessed as an additional one-time processing fee of $50. There's a plan A and a plan B for your payment. On the A, you have the 2 installments. The initial payment is $625, and then you pay another $625 within 30 days. Plan B is you can have 3 installments. You will have an initial payment of $450. And this is followed by your second one, which is going to be 30 days later, 400, and 30 days after that, your final 400. Payments can be submitted via Zelle or Cash App. You can use my telephone number, which is 832-289-6277. Other acceptable forms of include, you are so welcome, darling. I'm so grateful to have you here and so grateful that you're registered and ready to go. That's right, Larisha. I'm so happy to have that. Payments can be submitted with other major credit cards. You can use your cashier's check or money orders, but I do not take people's personal checks. And if you want information and you want registration, then feel free. You can email me at Deborah_Swisher@sbcglobal.net. I will send you that information and we can get you started and well on your way. Okay? Now, the other thing that we want to say is, let's see, the larger your device, whenever you do sign up, some people do it and they've completed whole classes with their phones, just their cell phones, okay? But I want you to know that the larger your device is, the better it is for you viewing, and it's better for you to retain information during the course. For example, a cell phone, you get so much, a tablet makes it better, a laptop makes it better, and a desktop makes it best of all. So I'm looking forward to the honor of having you join me during this week of July the 7th, 2025, for the day or the evening course, whichever one you choose. Choose the course time of your choice. Thank you so much. Now I want you to tell me what questions you have, what concerns, what information can I provide for you to further your knowledge on what this is all about and what we're going to do. I just want you to let me know do you have any questions that they're putting forth to us, Carlos? Anything of that sort?
Yeah, I haven't seen, everybody's been coming in and saying hello and saying greetings. I don't see any questions currently in the chat, but if anyone sends questions, we'll be able to pull those up.
Okay. Does anybody have any comments or any concerns, anything like that? Anything like that. And I want you to know that I do have also, I'm just going to throw that in. I do have my book, and I love my book, and it has been wonderfully received, and I'm grateful. And again, Carlos was my publisher. And that is this one, The 7 Imperial Gemstones of Life. This book covers things like relationships, and relationships with, say, love relationships, parental relationships, relationships in Christianity. We're talking the balancing act, any type of building your self-image and things of that sort. We have a lot of good information we have in the 7 Imperial Gemstones of Life. And then with Carlos's books, we also have, and I want you to know that his books are there and they're available for you at any time. You can go to poeticexpressions.com/shop and you can get my book and you can get any one of his. And I think the ones that we have now that we are doing and his have, we won't even talk about how exceedingly well. Publisher and all this. And he's written about 16 of them and includes my first book in one of those 16. And one of them is called Can I Pick Your Brain? This is on being a publisher and some of the things that he's experienced and things that we've gone through in publishing. There's another one called Heads or Tails. It's a book on poetry, and it's looking at the yin and the yang of everything. If we saw it this way, how would it be? Or if we saw it that way? And if I'm not saying this correctly, then jump in and correct me, Carlos, because
that's right.
I'm going on until we get a question or a concern or a comment or something, then I will stop. And then
we do have a few actually that have just come in.
That's good.
Okay, so here's the first one from Priscilla.
Is there a different certification for home health? No. If you want to be a certified, then you can get one specifically for home health. Yes, but if you want a CPC, CPC is all encompassing. CPC, Priscilla, says, I am certified in coding in every entity of medicine. It's the vanilla one. That there are sometimes people will demand, but I don't know that a home health nurse will demand that you have a certain. There is a certain one, but that one is not necessary. And if you get just, I mean, it's necessary for them. They may want it, but if you get just that particular one, it's not good for everything else. That's why I strongly suggest CPC. CPC is a coverall. The one that I have covers all of it. Thank you, Priscilla. And maybe you'll come back and see me some more. All right.
All right. And then we have one from Leslie.
Yes, you certainly can, Leslie. If you missed the first part, I did too, Leslie. I missed the first 5 minutes. I was trying to he was trying to help his mama, but she wasn't really, getting it together. But Leslie, yes, I think Carlos has told me that he'll have it to where it will replay and we can see it, at a later time.
Yes, it'll be on the Facebook page. It'll be there, and then it'll also be on the YouTube page as well, which that's DHS MCBC is the handle on that for YouTube. So it'll be up on there, but you'll be able to see the replay on the Facebook page too.
Very
on her
good.
Facebook page.
I knew you'd handle it for me, babe. Thank you. You're so welcome, Priscilla. Thank you. Thank you. Is there just a class for just billing? No, I don't do it. I'm sure there is one, but I don't do a class for just billing because let me tell you why, Jack. I feel that a class for just billing is ripping you off. Billing is menu driven. Billing doesn't really require a class. If you can read and just go with the prompts and the directives that gives you, it usually doesn't require a class. Coding requires for you to have to be able to work the art of coding. But billing simply says, I'm Medicare and I need you to fill in this blank, and this blank, and provide me with this, and this, but not that. And you see how once you read the directions, you can just kind of go with the directives and do what they're telling you. We will accept this, but we won't accept that. Now, coding tells you how to identify those problems. That therein is where you need the talent and the expertise. So no, I don't teach just a class for billing. Okay, what else did we have?
And that's the last one that I see as of now, of right now.
Okay. Well, anything you want to tell us, callers, or whatever? I'll give them the next few minutes to get together with whatever. We are so welcome, Jackie. Whatever questions they want to ask, or whatever presentations or comments.
Okay. Well, I just want to say, as someone who's taken the class, I definitely enjoyed it. It was really beneficial to me, and it really even changed the way that I look at TV and see things in everyday life, because I like watching a lot of documentaries. And so now when I watch them, I kind of pick them apart and I'll say, that's not right. Or, oh, that's kind of spot on because I remember that from class. So it changes the way that I look at medical terms and terminology, even when I'm looking at TV shows or movies or things like that.
Wow. Thank you for that. I cannot tell you how many students down through the years that have told me that.
Oh, really? Oh, wow.
I've heard that, and I'm so glad to hear it every time. I'm so glad to hear it. I hear that I never look at Grey's Anatomy the same anymore.
Oh, yeah.
So I'm on hiatus, and I absolutely love it. Ronnie and I love it, and it's called Doc. And I love it. I love it. I love the medical aspect. I love the other parts of it. I hate that it's, doing its, season renewal hiatus, whatever it is, because I'm missing it whenever I can record it when class is over and go catch it. But I do hear oftentimes people say to me that it changes the way I see things. They say, I understand my medical reports better. I understand better. I understand my child's reports. I'm understanding my spouse's reports. I see now why this is necessary as opposed to that. It helps clear up and provide you with a much greater understanding of medicine and those procedures and the things that we go through in the medical arena. I'm glad to hear that.
Yes, it's true. And I feel like, too, the class was definitely challenging, but it was doable because at the time working a full-time job, and as I'm sure most of your students are, and having their professions, but you're still able to come in and learn, and it was engaging, and I didn't feel like, oh, I'm bored, or when it's just going to be over, like I did in a lot of my college courses. So it was really engaging. Yeah.
Oh, mercy. Well, I'm so glad to hear that. We do have fun. We have enjoyed, and I have many, many students that come back. Many students, they come back and they come back for repeat classes, not because they didn't learn, but because they enjoyed themselves. And I'll tell you, for all of you all that are listening, I took medical terminology years before I started teaching. I took it 7 times, not because I didn't learn it, because I enjoyed it so. And taking it 7 times made it marvelous for me that I didn't realize at the time why I was taking. I just loved the terminology. I loved learning the language. I loved it was like learning a new language. And it was so refreshing to me to learn it. And little did I know I was preparing for the teaching aspect. But I took it 7 times until there was some teacher somewhere that said I was a plant. So then I had to quit because I thought, oh my God, if I'm starting to make the teachers feel intimidated, I can't keep doing this. So I quit doing it. But over about a period of 3 to 4 years, I took that class twice from Methodist Hospital. They offered it at MD Anderson when I worked there, and I took it 3 times at MD Anderson. And that's where the plant lady said. So I thought, okay. And prior to that, twice at St. Luke's Hospital. So I had taken it several times. I just loved it. And so a lot of students come back to me because they just loved the class. They enjoyed it. They enjoyed the engagement. We do real life scenarios. We do stories. We talk about things. I tell you anything that you think you want to know about me or my life or anything that involves or anything that I can. Because I believe that people learn better when they have an open mind and they don't have to be inundated with thoughts and questions that go unanswered. So they need to be answered. And I don't mind. Some of them may not make you comfortable. I may not be comfortable, but I'm definitely going to do my best to accommodate you so that you can have an answer. So we have a good time. We laugh, we grin, we tell stories, we eat the food. I try to eat it virtually, but it doesn't work yet. But we do have a great time in class, all the while learning a different language, a different field, and learning how to make much more money in medical coding and billing. I enjoy it, and I enjoy everybody that I've had, the hundreds and hundreds of people that I've met and known over the last 30 to 40 years. Hundreds and hundreds of people across land and country. And of course, now with Zoom, we can teach people anywhere. I've had students from Nigeria. I've had students from Canada and from any part of the United States that you can name. So you are able to be here. Thank you, Priscilla. Because of your class, I received a refund for a bill I received because I researched and found they billed the wrong diagnosis code. Yes. Thank you, Miss Deborah. You are so welcome, Priscilla. That makes my day.
That's really cool.
That is really cool. Oh, Priscilla, thank you. And Priscilla, you know what else I always want to thank you for? And I said thank you once before, but I'm going to thank you again. We had a concert at my church. And it was not last year, it was the year before. You came to that concert and you happened to be there, or you came from Louisiana. I was so proud that you came with your family and you enjoyed it. And we were so happy to have you come, and we enjoyed having you there. You made my day, and you made me some of the best pralines I've ever had in my life. They were delicious. So just in case, I'm just putting that out there. If you want the best pralines ever, y'all check out Priscilla Beller and then let her get those to you, because you won't be sorry. Thank you so much. That was wonderful to know. Anything else? Anybody have anything else you want to tell us? Well, we have reached 7:15. Thank you, darling. Thank you so much. And if there's nothing else, I want to thank you again for tuning in. I want to thank you for participating. I thank you for coming on and for listening and for adding in. And I'm just grateful. And I will wait to see which ones that we will hear from later on. And you are welcome to contact me at any time. You can contact me by phone or you can contact me by email, whatever makes you happy. I will get to you and I will answer you just as soon as I can. And I thank you again for your support, for your attention, for your time, and for signing on and being here with us on this evening. Thank you so much. And if there's nothing else, I will. Thank you so much, Natasha. You have a great night too, and everyone else do. Thank you so much for signing on. All right. Goodbye. Thank you. Thank you so much.